Well, many people start diets, exercise plans, lifestyle changes at the beginning of a new year. But how many people are still on board here now, 3 weeks into it? Well, Dr. Tim Christopher, a bariatric surgeon from Shelby Baptist Medical Center, joins us. One of the things that so many people start out with is some extreme diet. But that may not be the best way to go about it, right?
Right. Most diets fail just because over the long haul, most people don't change their lifestyle. So most things are difficult because it is lifestyle dependent. Ultimately, weight loss or gain comes from calories in and calories expended. So if you're eating a lot of high-calorie foods and not exercising, and that's your lifestyle, you're going to gain weight. So most things are difficult. What most people don't realize is that your body kind of works against you. So your body likes to maintain a set point. So if you're maintaining a certain weight and you go on a diet, particularly an extreme diet, your metabolism falls, your hunger boosts, and so your body pushes you back to that original set point. So your body is kind of working against you.
Or maybe even beyond that set point.
Absolutely.
Right? So losing a few pounds is one thing, but for someone who's really trying to lose a good bit of weight, bariatric surgery is an alternative. When do you know if someone is a good candidate for that?
So when we talk about being overweight, it is kind of a gradation. There is a tipping point where we define it as morbid obesity, which is you have health-related problems directly related to your weight, which is estimated about 100 pounds over an ideal body weight, or a body mass index, what we call body mass index of 40 kilograms per meter squared. So it's at that point where your risk of high blood pressure, diabetes, sleep apnea, those type things really escalate and accumulate.
Carrying all of that weight is really
carrying an extra 100 pounds, right? Okay. So that's when your body is basically breaking down and not functioning as it should, which over a period of time, if you're in that morbid obesity category, it really cuts years of life expectancy off. Okay.
Now, when we talk about bariatric surgery, some people think it's like a magic wand, ta-da, the weight is gone, but it's much more involved.
Correct. And the surgical process is evolved over time, but it basically is a tool. So there have been many aspects tried, so the most popular surgery out there now is a sleeve gastrectomy, which limits the amount of food you can eat at one time. There's also metabolic things going on in the background as well, but basically it gives you a tool to be able to consume less calories, but you still got to eat the right things. And you got to exercise. So just as somebody's going to lose 5 or 10 pounds, you got to change your lifestyle and eat right and do the right things. This is for people that are severely morbid obese who can't lose weight on their own. It gives them a tool to be successful where they weren't able to be before.
But it is going to change their lives.
It is a life-changing experience. So that's why people that are considering it need to understand what they're getting into and be able to be prepared to make those changes over the lifetime.
All right, great. Dr. Christopher, thanks for being with us. We appreciate you being here.